Hi, let's talk about ADHD. Millions of Americans suffer from ADHD or believe they have ADHD, yet they don't know what it is. ADHD, or Attention Deficit Hyperactivity Impulsive Disorder, has three different types. First one is inattentive type, second one is hyperactive impulsive type, third one is combined, which is a combination of the two. Let's go through each of them and talk about their signs and symptoms. So the first one right here is inattentive type. You must have at least 5 of these symptoms in order for you to be diagnosed with inattentive type of ADHD. First one is not paying attention or making careless mistakes during assignments, at home, or at your job. Not being able to stay focused, meaning whenever you are doing your school assignment or doing assignment at work, not being able to stay focused on it for a longer duration. Not listening when being talked to or seem to be elsewhere. Not being able to complete tasks or not following through on the assignments that you have started, whether that's a school paper or a project at work. It can also be things that you start at home, such as starting to do your laundry and then not finishing it. Being disorganized, having poor time management skills, and being messy or missing deadlines. Not having an idea of time and always missing deadlines. Avoiding or disliking tasks that require sustained mental effort, such as completing forms, completing long projects, or filling out paperwork. Often losing things, such as your wallet, your keys, your glasses, cell phone, etc. Being easily distracted. Forgetting daily tasks such as paying bills, doing chores, bringing groceries, common things. This one is hyperactive impulsive type. Hyperactive means as if you're always on the go, always moving. Impulsive means taking actions without thinking about the consequences. Again, you must have at least 5 of these in order to be diagnosed with hyperactive or impulsive type of ADHD. Fidgeting with your hand or feet or squirming while being seated. Not being able to stay still. That can be at school, at work, or any public place. Constantly wanting to get up. Inappropriately running or climbing at the places you're not supposed to be running or climbing. Always being on the go, or as if you are driven by a motor. Talking too much or talking unnecessarily. Blurting out the answers before the question is finished, or finishing other people's sentences. Difficulty waiting in lines or difficulty for waiting for your turns. Interrupting others or intruding into things that they are doing, such as interrupting into others' games or taking over the things that others have started or using other people's belongings without their permission. You must have 5 of these in order for you to be diagnosed with this hyperactive impulsive type. ADHD symptoms begin during the childhood. You must have these signs and symptoms before the age of 12, and these symptoms must be present for at least 6 months in order for you to be diagnosed with ADHD. ADHD is usually diagnosed by a mental health care provider. They will ask series of questions to the patient about signs and symptoms. They will also require the patient, their caregiver, and the parents to fill out some questionnaires and forms. There is no blood work for ADHD, neither is there any mental imaging. You may be inquired about the family history, medical history, and any genetic testing. You may be required to further undergo more medical evaluation to rule out any of the medical conditions. ADHD can also mimic other mental health disorders such as anxiety, substance abuse, mood disorder, and many other mental health disorders can mimic ADHD. It is always best to contact your healthcare provider, and especially mental health care provider, if you believe you're suffering from ADHD. Thank you for listening. Have a blessed day.